Does losing weight treat PCOS? Does changing food habits regularize your periods and improve fertility? What impact does smoking have on PCOS? These are some of the common questions I get from my patients who suffer from PCOS. Hi, I'm Dr. Soumya Tripathi, and today I'll be talking about the role of diet, its composition, the role of micronutrients, and most importantly, what foods to avoid if you have PCOS. Do watch the video till the end to understand how diet can treat PCOS and even prevent it in the first place. Lifestyle modification has a huge impact on the symptoms of PCOS. A loss of just 2 to 5% of your current body weight can lead to a decline of almost 21% of serum testosterone levels in the body that is high in PCOS. 30 to 50% of all women who have PCOS are obese. Almost 50% of all overweight women have PCOS. Obesity, which is defined as BMI of more than 30, not only increases period irregularities, but also increases the incidence of infertility and pregnancy complications. So, why does this happen? This is because obesity compounds the symptoms of PCOS, and you must know of its impact in order to understand which diet to follow. If you decrease your daily calorie intake by 500 to 1000 kilocalories, then you can reduce 7 to 10% of your body weight in a period of 6 to 12 months. For this to happen, you must choose a diet that is low in carbs and fat. So your diet must include fibers, whole grain, cereals, fruits, and vegetables. This will reduce the sugar load in your body and thus decrease the insulin levels and insulin resistance, which is a major problem in PCOS. It is generally recommended that you should divide your calories into 4 to 5 small portions throughout the day. This will help to improve your metabolism and prevent binge eating. An example of an optimal food plan is: have your breakfast 1 hour after walking in the morning, have a heavy lunch about 2 to 3 hours of having your breakfast, have healthy snacks such as fruits, salads, and sprouts 3 to 4 hours of having your lunch, and have an early dinner about 3 to 4 hours before you go to sleep. You may modify this diet based on your daily schedule and consult a dietitian for it. So, what are the food items that you should have? Lots and lots of green leafy vegetables like spinach, broccoli, parsley, and lettuce. Whole foods such as whole grain bread, and rich sources of proteins such as fish and eggs. Spices such as turmeric, cinnamon, fenugreek, and ginger have proven anti-inflammatory properties and are helpful in tackling PCOS. Fruits which are low in fructose and high in fibers, such as berries, oranges, pineapple, lime, and lemon. Food which is rich in omega-3 fatty acids, such as olive oil, liver oil, avocado, and flax seeds. Please avoid excess tea and coffee, and food that is rich in carbs, such as white rice or pasta, fruit juices and smoothies with added sugar, sweets and ice creams, and packaged and stored food, as they increase the blood sugar level, increase insulin resistance, and predispose to the development of diabetes. Cholesterol coming from your food should be less than 30 milligrams per day. You can decrease it by avoiding deep fried food such as French fries or vada, and decrease the sources of saturated fatty acids such as ghee, butter, dalda, etc. Let us now discuss the importance of micronutrients in PCOS. Please include tomato, orange, whole grain, onion, and seafood as they are rich in chromium, zinc, and magnesium, which treat acne and obesity in PCOS. Include green vegetables, eggs, milk, and paneer, as they are rich in calcium, which has an important role in follicular development of the ovaries that brings about ovulation. Spinach, eggs, beans, nuts, and seeds are rich in vitamin B complex that helps in maintaining the normal body metabolism, normal thyroid function, and normal hormone levels. Make sure that your diet is rich in vitamin D, as low vitamin D leads to the development of insulin resistance, weight gain, and also plays a role in infertility. Does smoking have a role in developing PCOS? A simple answer is yes. Smoking is not only a risk factor of developing heart disease, but it also amplifies the effects of metabolic syndrome, which is a triad of diabetes, hypertension, and cardiovascular disease. It increases the level of bad cholesterol or LDL and decreases the level of good cholesterol or HDL in the body. And it also decreases the fertility rate. So, quitting smoking not only improves your blood circulation to your ovaries, but it also reduces the risk of developing metabolic syndrome, improves fertility, and balances the mood swings which is associated with PCOS. PCOS may be difficult to treat, but it is not impossible. With the right approach and proper guidance, it is easy to manage the symptoms. In the next video, I will be talking about the role of exercise in the treatment of PCOS.